Thank you everyone for joining us today. If you don't know, I'm Maria Khalil and I'm the CEO here at VI Peel, and I'm super excited to have Janelle Ocampo with us today. And Janelle is a nurse practitioner and she also owns a beautiful med spa here in Southern California called Bellevie, which is the Instagram you're joining us from, right?
That's right.
So can you tell everyone a little bit about you and Bellevie?
Yes. So my passion for aesthetics came from my first Botox visit over 15 years ago. And I just fell in love with the results and how amazing it made me feel and my renewed confidence. And so I really wanted to be able to share that with other people and help improve their confidence so they can feel good about going about their everyday and feel empowered. And that's really what we've been about and what I built Bellevue on. So we have two locations, one in Cerritos and one in Costa Mesa. We just recently opened the Costa Mesa location. I'm also a trainer for Allergan, so the treatment of Botox and fillers are my specialty. And so I have been using their products all along, and I train for the company.
Amazing.
Yeah.
And I mean, yeah, your reviews online speak for themselves. So many amazing reviews, and you're obviously making a huge impact on people's lives through your services, right?
It's really important to me that patients are satisfied. They have to go out of this office feeling better than the way they felt coming in, and we really offer that in every single one of our services. We want them to feel amazing, and
Can you
VIPO
kind
has been a big part of that.
yeah,
Yeah.
how long have you been using VIPO? Do you know?
VIPO, I want to say probably about 12 years. It's definitely been more
Wow.
than 10 years. Yes.
Wow. I meant
Yes.
to look that up before, but I
Hmm.
remember looking it up earlier in the year and it was a long 12 years. That's amazing. I mean,
Yes.
so you're
Yes.
probably one of our longest and best providers of the VIPL. So thank you for that.
Thank you. Thank you. Well, we love VIPO, the impact that it's made on our patients. We have so many requests of patients coming in for Botox or some sort of injectable treatment. And for us to be able to offer something to treat the canvas as well, just overall improves their entire satisfaction rate. It's wonderful.
It's so
Yeah.
important not to forget the canvas. So many
Yeah,
people forget about that.
absolutely. It's easy to have that tunnel vision and just do what they ask, but they don't know what to ask for necessarily. They become hyper focused on this one thing and they don't really understand what else is aging them.
So can you walk us through your method, basically, like when a patient walks in your door? How do you go
Yeah,
about? Yeah.
absolutely. So when we see a patient and they come in and they ask for something specific, maybe Botox, we let them know that we also offer other services, and we discuss some of the services. And one of the things that we do too, especially for a first-time patient, is we give them a card that they can check off different things that they may be interested in, and it helps us open up that conversation. Because sometimes as a provider, it's a little hard to say, well, you have these brown spots or your skin, doesn't look as brilliant as it should. Um, and sometimes when they don't mention that even on the card, I will have that conversation because I think they're sometimes afraid to also check off those boxes. And so I try to approach it in a very neutral way and just let them know, hey, there are some other services that I think you can benefit from. And these are some of those. And a lot of times I hear from them, I didn't know you could do that. You know, I've also had incidences where patients have been my patients for a while
Mhm.
and I bring something up to them and they say, I didn't know you offered that service. And it's a painful reminder that we need to be comprehensive in our approach with our consultation. And VIP is just such an easy add. And in most cases, we can add that on without adding additional appointment time. We can simply add that onto their service and apply it right before the treatment. And when their Botox and fillers kick in, they're happier because the quality of the skin is better as well. It improved our ticket sale, our per ticket revenue, so it helps with the bottom line. And the patients are more likely to return. You know, one of anything doesn't cure everything. And so we should be seeing them again in a month, or for maintenance, maybe 3 months for another VI peel. It's the same thing with Botox. We need to schedule them in a few months for the next Botox treatment. And I know that for a lot of offices, it's really hard for them to be consistent with scheduling that next appointment. With VI peel, I think it's a little bit easier because it's a closer time frame. Both of those appointments need to be scheduled, but with VI peel, patients have a better understanding of what they're going to be doing a month from now. And so it increases the frequency of them coming into our office, which means that they're likely also purchasing other treatments. But aside from that, they're a happier patient because the quality of the skin is just so much better.
Yeah, I
Yeah.
think not everyone always remembers about that exterior like paint job. You can't, you
Yes.
have to focus on that too. You can't just be filling and freezing the muscles. But talk to us about how you use the VI peel in same day treatments. I think it's a really fantastic thing you do in your office. And I'd love our
Absolutely.
practitioners to hear more about it.
Yes. So when we apply both, what we do is we first prep the skin and apply the VI peel. And I'll just say a drip inside the little container and a 2x2 gauze. And so then I go ahead and do the Botox treatment immediately after the VI peel. The skin is already partially anesthetized because the VI peel has been applied, so they have less pain. And then if there's any little drips of blood, I go ahead and wipe it away with that clean 2x2 gauze and the tiny little bit of VI peel that's left in that container, which is just a drip or two. And overall, it also makes it a safer treatment because their skin is better cleansed than just a swipe of alcohol. Yeah.
Yeah, we've talked about this before, right? Where practitioners are conditioned into thinking like, I need to use the alcohol, I need to swab it. That's how you make the area sterilized. But actually, the pH level of the VI peel is so low that it might even be a better sterilization method than just alcohol.
In addition, the multiple passes, applying acetone and then applying the VI peel and all the passes that you are going over the skin, it's just much better cleanse than just a swipe of alcohol. It really is. Yeah, and it makes for a more comfortable treatment and an overall
It's
better outcome in 2 weeks. And this is safe for all skin types. So no matter who's coming in this door, to see us for an injectable treatment, they can safely add VI peel and improve the quality of their skin. It's versatile, it's safe, it's consistent. All the reasons that I love VI peel.
So thank
Yeah.
you. So
Yeah.
someone asked, what about the color of the peel? Does it interfere with injection at the injection site?
Never has. And you may be able to answer this a little bit as well, but it does no staining to the skin. It doesn't change the level of discomfort or anything like that. If anything, it makes it a more comfortable treatment because the skin has some level of being anesthetized.
Yeah.
Yeah, but it does
Because
not harm the skin to poke the skin with a needle, even with the slightly thicker needles for dermal fillers. Yeah.
and the other thing I think, especially now, since all the protocols are probably going to change after we all reopen, and you might not be able to see as many patients in a day, right?
Yeah.
So
Mm-hmm.
being able to have the patient sit in your chair and do both the treatments, how long does that appointment even take?
It could potentially take 15 minutes. And at this point, for our reopening, we're going to be extending that time. So even a simple Botox patient is going to have a longer appointment time because we are decreasing the amount of traffic coming in and out of the office. So it makes it even easier to add other simple services. But VIP only takes a few minutes. So it's a matter of just managing the time, that conversation with the patient. And it's the same thing with Botox. It just takes a few minutes. And if you're prepared ahead of time, it can be a very quick treatment. So it is an easy add-on in one visit. Absolutely.
That's
Yeah.
fantastic.
Yeah.
And maybe we can elaborate a little bit more on why you need VI peel and Botox. So maybe like how they both have methods of working on your skin that maybe the average consumer might not understand.
Yes. So we know Botox is the best wrinkle relaxer out there, right? It's got a name on the market for a reason. It's been around for a long time, and it's a wonderful, safe product. It'll smooth your lines, but it does not change the quality of your skin. So 2 weeks later, you're going to have smoother skin. But if you have rugged looking skin, lack of brilliance, hyperpigmentation, the brown spots, and those aren't addressed, it's still going to, your skin is still going to look older. So you can't just address the skin on in terms of what's happening underneath. You need to address the most superficial layer as well. And that's where VI Peel comes in.
Perfect. Does Botox actually remove wrinkles?
Well, it's a muscle relaxant, so it stops lines from occurring, and then the skin heals over time.
Okay.
And the way VI Peel can help heal the skin too is that superficial collagen remodeling that's occurring to help smooth fine lines as well. Yeah, so they work in conjunction, absolutely.
Yeah, and I read a statistic the other day about how pigment actually made people look older than fine lines, which I thought was
I think I read that same one that you read. I saw
okay.
that too. And so maybe it's being recently talked about. But I agree. You know, if you have a lot of hyperpigmentation, and as we get older, it's not the same cute freckles that we're looking at. They grow and they get blotchy, and the
Yeah.
skin tone is overall different as we get older, and it's a sign of age, and we don't even realize how we're judging other people. But pigmentation is definitely a very big factor that needs to be addressed.
Yeah, that was surprising to me. I
Yeah,
didn't like
I think
reading
I
that
read
was
the
very.
exact same thing that you did.
I'm sure we read all of the same things.
Probably.
So,
Probably.
who would be the best candidate for this combination therapy of Botox and VI Peel?
Well, I think anyone that comes in for Botox would be a great candidate for VI Peel. Um, you know, what that treatment will do is slow down aging, reverse some fine lines, improve your pigmentation, and stimulate collagen. Who wouldn't benefit from that? It's really anyone.
It's just so fantastic, those two
Yeah.
together. It really could be life changing, honestly.
Mm-hmm.
Like,
Mm-hmm.
it's like starting all over again. And I think when we all get out of quarantine, we're all going to want to come out with a bang. We're all going to,
Yes.
so we're going to
Yeah.
be making our entrances. And Botox and VI Peel is a really great way to make that entrance.
Absolutely. And I think a lot of people are still slowly going back to their daily lives. So they are more open now than ever to do things that might involve a little bit of downtime. In my opinion, VI Peel really isn't a lot of downtime, but you do have some peeling involved. And right now, a lot of people are working from home, or they're working less in the office. And I think it's a treatment that they've been thinking about for the last 2 months, and
Yeah.
they're ready for it.
Yeah.
So I think we need to be prepared for that demand as well. Yeah.
Totally. I get so many texts saying, I'm stuck at home. This would be such a good time to do a peel. Can I get one?
Me
And I'm like,
too.
no, you can't. I can't
Yeah.
give you one, but soon. And you're right.
Absolutely.
It seems like people will still be working from home, even maybe as our practices open. So they still have that flexibility to be peeling while they're home, which is great.
Yes.
And I
Yes.
know we don't know when we're going to be allowed to reopen yet. We're all dying to come back to Bellevie, I know. But maybe you can talk about like some of the things that you know are going to change in your practice when you
Mhm.
reopen.
Yeah, so I've been preparing. There's a lot of things that we're doing. In terms of booking patients, we're pre-screening them and asking them if they have had a recent cough or fever, or have been exposed to anyone with potential COVID-19 symptoms in the last 2 weeks. We also are going to ask that they come wearing a mask at all times, and bring a second mask for after the treatment, because we don't want them putting the same mask on if it's dirty. So I think that's a safe way to just have them plan ahead of time. And those appointment reminders, email and text reminders, are what we do. Those reminders need to include that information, and also let the patients know that not to bring any guests with them. So we need to minimize the amount of traffic in our office, and be aware that while they're waiting to be brought back to a room, instead of waiting in the waiting room, we'll ask them to wait in their vehicle and we'll call them when we're ready. All these things to help protect the patients, because if we can minimize our exposure in the office, we could minimize any potential exposure to them as well. Yeah.
That's wonderful.
We're also going to use kiosks in our
Okay.
office, and we may even have patients sign forms at home ahead of time through our EMR, and we're looking at that as well to see if it's user-friendly enough for everybody to do that. And floor spacers to show patients what 6 feet apart looks like as they're in the clinic to avoid the crowding. A sign on the window so they know as they enter some of the things that we're going to be doing to screen. We have plexiglass on the front checkout area.
Wow.
Treatment rooms, providers are going to be wearing masks. Their temperatures will be checked daily. And if they are doing a treatment that involves removing of the mask, they will also wear a face shield to help avoid any potential exposure as well. So we have quite a few things that we're putting in place. It's a lot to think about as a provider, what we can do to help protect the public and protect the staff. Yeah.
Those were some really good tips, I think, that you've done to prepare. So
we're also bringing in air purifiers that not just have HEPA, but UV light in them to help filter the air a little bit better.
And what are the kiosks for? You mentioned
those are for because we have an EMR for the electronic patient check-in, so they'll go ahead and sign their consents on a kiosk.
Nice.
Yeah.
So no like touching papers or touching pens or.
Right. And then we can just clean the kiosk in between each patient.
Mm-hmm.
We'll have them hand sanitize as they come in, and their temperatures will be checked as well, in addition to the screening in person. On recent illness or exposure to anybody in the last 2 weeks.
Sounds like you're doing a lot of good preparation.
It's a mouthful. We are.
Wow. It really is. So, someone asked what your preferred peel is. The Precision Plus or regular.
I think amongst all the providers, it's going to be Precision Plus because it's the biggest bang for your buck and treatment. We sure do sell a lot of the regular VI peel because of the price point and the versatility of it, and VI Purify for our acne-prone patients. But I would, if I took a poll in this office, it would be Precision Plus. Yeah.
I could see that. I think if we did a poll, that would probably be #1 for sure.
Yeah.
It's such a fantastic peel for pigment.
Absolutely.
And it's really great for higher Fitzpatrick types, which are usually people coming in with the pigment. I mean, so you get to treat them safely.
Yeah.
Someone asked, they live in Bermuda, and I guess maybe they're concerned with using the VI peel with humidity or heat. It's a great question, and we get it a lot. Peeling in the summer, peeling where it's hot, peeling where it's humid. We live in Southern California.
Yeah.
It's not humid necessarily, but, do you have any tips for someone that's going to be peeling maybe in heat or humidity?
Well, depending on how much they sweat from the area they're peeling from, they're going to want to dab their skin and not rub, right? Because I think the skin can peel a little bit more prematurely. So they just need to take extra precaution. But it is not a contraindication. Being cool might be more comfortable for them, but they're going to get through the peel just fine. Another thing is heat and humidity could potentially bring up melasma. So it's a great reminder for these patients to make sure they're on a great maintenance product to help maintain the results of the VI peel as well, and make sure they're avoiding sun exposure pre and post VI peel. But just like if you're in a hot shower, some people make the mistake of exfoliating their skin or rubbing their face and not realizing and taking off the skin too soon. So my recommendation in a humid environment is just to take extra precaution, extra care for your skin and not rub or exfoliate. But I don't personally see that as a contraindication or anything like that.
Perfect.
Yeah. How about you? Is that what you think?
Yeah, I think places like Florida, it's always hot and it's always humid, and they're doing peels year round. Yeah. Now, we really want to limit sun exposure all the time. So whether you just had a peel or you didn't just have a peel, you know?
Yeah.
That's first and foremost. But sure, if you just got a peel, be extra cautious. Try and avoid the
Hmm.
sun as much as possible. You know, they end up being indoors a lot when it's really hot outside anyway and humid.
Hmm.
So,
Hmm.
you know, try and stay indoors and not directly in sunlight, I would
Yeah.
say. But yeah, like you said, baby the skin. You should really never rub your skin. I mean, whether you just got, right?
Yeah. Yes. Great in theory, though, right? I get the
Yeah.
call once in a while. They took a shower and they didn't listen and they exfoliated, and now what, Janelle?
They went to town. I know.
Yes. Yes. Yeah. And
And
they,
the thing is, you'll heal and you'll be okay.
yeah.
Your process is a little longer.
Yeah, I'm like, double your recovery. You're gonna peel again.
There you
Hang
go.
in there.
Yeah,
Hydrocortisone. It'll sting a little bit. You're gonna get through it, and your results will be even better. But now you've got to get through this. And
exactly.
everybody has gotten through it.
We get through it.
Yes.
They hate us on like day 3
Yes.
when their face
Yes.
is falling off, and we're like,
I
you're
think
gonna
I've
love
been
it.
forgiven every time. Every time, though. I'm
That's,
forgiven. I warn them not to exfoliate in the shower or pick or peel, but
I know.
it's tough for
People
some
can't help
people.
themselves.
Yeah.
Someone
Yeah.
asked, it's a great question. What peels best for rosacea or like ruddy skin?
So, in terms of rosacea, I think it can flare it up, and any manipulation of the skin can flare up with a peel. But I don't see an issue with applying any of the peels. Do you? Do you see a contraindication with any of the
No,
peels? Yeah.
no. We've
Yeah.
actually seen a
Hmm.
lot of improvement with rosacea. I would say like probably start with the regular VI peel
Yeah.
and
And if
see.
it's acne rosacea, then Purify I think would be great. But I don't see a contraindication. It's
Yeah,
just they might potentially, especially while they're going through the peeling process, feel a little bit flared up.
yeah, for sure. Everyone has different things that flare them up too. Everyone's
Hmm.
rosacea is very different. So
Yeah.
it's this person asked, what do you recommend for a 20-year-old on birth control pills with pigment issues, post peel and between peels?
Well, that's a tough one because sometimes pigmentation can be caused from that birth control. And so that's a conversation they may want to have with their doctor on the continuing of it. But sometimes, even if they were to discontinue the birth control, that pigment is triggered and it's there, right? And my recommendation is do a series of peels at 4 to 6 weeks apart, a minimum of 3, and make sure you're on great maintenance. And my recommendation is to do it every 3 months for maintenance. When you're on the maintenance phase, make sure you're on hydroquinone, and you can cycle off and on. But when it comes to pigmentation related to birth control pills, which is typically melasma, it's a chronic condition and their bodies are going to reproduce it. So they have to work diligently to maintain their skin, do regular peels, stay out of the sun, make sure they're using a great SPF, because it can return because their body's going to produce it again.
And do you like them using like a topical with hydroquinone, or is there another ingredient you like better?
No, yeah, I definitely, the first thing I would put them on is hydroquinone.
Okay,
Yeah, as long as there's no allergy, of course.
perfect.
Yeah.
Yeah, I see so many women now with the melasma and hyperpigmentation from birth control.
Mm-hmm. Yeah.
All Fitzpatrick types. It's definitely becoming like a very wide issue.
Yeah.
And so like you just said, even when you stop, it doesn't go away. Is that true?
Yeah, well, a lot of times once those melanocytes are triggered, they don't just go away. Yeah.
Tough.
Yeah.
Yeah.
So
I
we
mean, I got
can
it.
we can work on it from the outside and sometimes get it invisible or close to invisible, but it involves maintenance.
It involves maintenance.
Yeah. Yeah.
That's a
Yeah.
tough pill to swallow. I think everyone wants a quick
Right.
way to solve the melasma, and it's something that's going to be it's going to be lifelong.
Yeah. Or quite a while at least.
Yeah.
Yeah.
Um, this is a great question. How can you tell the difference between an age spot and melasma?
Well, typically melasma is symmetrical. So you'll see like a patch of pigmentation on one side and it's very similar to the patch on the other side. You'll find it forehead, cheeks, bridge of the nose, or upper lip, and those are very common areas with melasma. Where an age spot, you typically will see one spot on one side of the cheek. And so they often present differently. And sometimes it could be a little vague and you don't know exactly, but that's classic presentation and the difference between the two.
That's really helpful.
Yeah.
And would you treat them differently, or would
Well,
peels be good for
with
both?
peels, not necessarily. I would treat both the same way with peels, but sometimes I can laser an age spot where I wouldn't do that with melasma because it will just cause rebound hyperpigmentation. So with melasma, I just don't recommend laser. Yeah, and
Interesting.
I would just treat with chemical peel. But when it comes to hyperpigmentation related to sun exposure, sometimes we can do combination therapy. We may do chemical peels to help the skin all over, but if there's a stubborn specific spot, we may end up lasering that with an IPL or a Q-switch laser. We wouldn't do that with melasma.
And is that because melasma gets worse with heat? Is that,
Well,
why?
the theory behind why it flares up with laser is a little bit confusing because different technologies have been presented to us. Well, this isn't heat based, and so it's not going to flare up melasma. And we've still seen some rebound hyperpigmentation after treating it with different types of laser. So yeah, I do think it's heat driven, number one, because we know that melasma flares up with heat. We've seen some people that are cooks in the kitchen and their melasma is really bad, and we know they're over steam, and heat is an issue. So heat and laser is probably definitely a big issue. But we've seen other lasers that don't necessarily generate that type of heat, and those treatments have also we've seen rebound hyperpigmentation post laser, and so it might not always be heat, and I'm just not sure of the exact
Okay.
answers to why.
That's
Yeah,
interesting.
yeah. Like with
That's
Pico technology, it hasn't necessarily been consistent with us for maintaining melasma results. Yeah,
that's really good information.
yeah.
And someone asked, is it safe for sensitive skin with a vitamin C allergy? Does it help with adult or hormonal acne? So actually, there is vitamin C in all the VI peels. So if you have an allergy, then it's not going to be safe, unfortunately.
Yeah, a C allergy is quite rare, and so I make sure you really are allergic to C. But I have seen it. I think in
Okay,
15 years,
you
maybe
have seen
once, but
it.
I have seen someone with a vitamin C allergy. But it's really rare to see that. Yeah.
Yeah, so I guess they're trying to treat their adult or hormonal acne, but they have vitamin C. So, I mean, there's topicals they could try that don't
Yeah,
have
there are
vitamin C.
different types of treatments, and one thing doesn't necessarily work for everybody. It may work for a lot, but it doesn't work for everyone. So luckily, there are other therapies out there that they could potentially benefit from.
Perfect. Oh, I only get a reaction when it's applied to my skin. So not when she, I guess, eats an orange or drinks orange juice, I guess. Only when it's applied to her skin.
Hmm,
I wonder if it's like irritation, because sometimes vitamin C can just irritate.
irritating.
Hmm.
Yeah, it would be hard to say for that person. I don't know if they have seen it consistently with different product types, or maybe she's assuming this is an allergy when it was a different product in whatever that she had used. But I wouldn't recommend trying it again if you feel you have a vitamin C allergy.
No. And
Yeah.
one thing you can do is you can try like spot treatment with
Mm-hmm.
a peel if you want to see if it's going to react. Obviously, you go to a practitioner and they would have to do it safely, but they can do a spot treatment somewhere kind of hidden and see how you react.
Yeah.
If you're not maybe 100% sure it's a vitamin C allergy.
Mm-hmm.
And we're getting a lot of questions about the hydroquinone. And so we recommend the VI Derm Beauty
Mm-hmm.
hydroquinone. We actually have 4%, which is prescription. So you would only be able to get it at one of our VI offices. You cannot get this online. You would need to go on our website, put your zip code in, and then we're drop shipping on behalf of accounts right now if that's an option if the office isn't open. But this is, I mean, 4% hydroquinone, it's a gold standard, and it's not available online. It's not a product you're going to find in Sephora or Walgreens or anything like that. This is real medical grade results from this product. And they asked about cycling on and off. What's your recommendation usually with hydroquinone and cycling on and off?
My recommendation is typically people will get through a product in 2 or 3 months. After that, I'd recommend they cycle off and then get back on. Yeah.
That's what we recommend too. And I know how hard that is though.
I know
You just changed this woman's life. You just, took her melasma away and now you're telling her she has to stop using it for 3 months. It's really hard.
And I recommend going down in days. So if you are using it for 7 days, you can, the next week go down to 4 or 5 days and then go down to 3 days and then cycle off. So you're slowly cycling off and going on to another natural lightening agent. And then you can get back on in 2 or 3 more months. I mean, you don't want your skin to plateau anyway. So give your skin a little bit of a break. You'll do great. Protect yourself well from the sun. And yeah.
That's the one. Protect yourself well from the sun. I mean,
yeah.
I know it's like we sound like a broken record probably, all of us. We're like, wear sunscreen, don't go in the sun. But that's the worst thing for your melasma and your hyperpigmentation. I mean, there's no secret there.
Yeah.
And heat. It's also the heat. It's not even just like the direct sunlight. It's also just heat that brings out that pigment. So
many times people come back and say, I went to Hawaii, but I swear I wore a wide brim hat, SPF a bazillion, and my melasma is really bad again. And I have to remind them that heat also brings it out. And what do? You have to figure out the life balance. You can't just not enjoy your vacations and travels, but you have to be aware that this is a factor. So anytime you can avoid the heat, it would be great for your skin. And if not, then just figure out that life balance, and VI Peel will be here for you.
And you even mentioned before, not only like the heat from being outside, the heat, I guess they were a chef, the heat from like cooking. Yeah. Yes. So someone said heat from water. Yeah. It's heat from all of these saunas, like all these things, they can bring the pigment. So no, it's not just the sun. It's heat in general. And summer's coming, so stay out of the sun.
Yes.
I think that's good. We answered a lot of the questions, some really great questions. Thank you everyone for submitting your questions, and thank you so much, Janelle. I learned so much from you.
Thank you for having me.
I always learn so much from you, and you're just so wonderful. You have such a good spirit. So thank you for working with the whole VI Peel team. We really appreciate it. And
it's such a privilege. You guys are amazing, and it's a privilege to be able to work with you guys as well and carry your products. And I've loved it since the get-go. And
I'm such a huge fan of you and Jasmine.
Back.
Yeah, I'm such a huge fan of you and Jasmine, mother-daughter team. I think it's the sweetest thing. I love seeing that. It's so special. So
it's just amazing. Yeah,
it's so great.
Awesome.
It's so wonderful. So keep in touch, and we wish you the best of luck through all this, and we hope it's over for all of us, but we know we're going to all open when it's safe and when it's right, and we're just waiting to hear.
Yes, that's right. I can't wait.
Okay. Well, thank you so much, Janelle.
Thank
you. Talk to you soon. Bye. Bye, everyone.
Bye.